Hello,
Hi there.
how are you?
I am well. I am on the West Coast right now.
Oh, that's right.
Yeah.
Portland?
Yeah, and it's
Okay.
snowing like crazy.
I know, Rob. You got us. This is the first snow I've seen here.
I know, honestly, like I am shocked that we flew out yesterday afternoon and I'm shocked that we made it. All right, so let
I
me
did not know it was snowing up there. It is definitely not snowing here.
Mark, you're in California, right?
Yeah.
All right, I'm gonna shift the host around because I'm not planning on staying on very long. I'm technically not working today.
Okay.
Let's see if I can do that on the phone. Oh wait, participants. Okay. Francisca, do you want to be the host or should Ryan be or Mark?
I was gonna say probably Ryan. Or Ryan, you're on mute.
Feel free.
Actually, let me start make let me make everybody who's here right now co-hosts first, just so you guys all have some rights.
Yeah, I was gonna suggest make us all co-hosts and make Ryan the host.
Yep.
The ultimate power.
Okay, and let's see if there's anything complicated I need to do before we pass that over. Do we want to keep the waiting room, or do we want to just make it open?
Well, I think for now, because we don't want everyone coming in right now, right? While we kind of test sound, so let's keep the waiting room for the moment.
Okay.
Yeah, the only other people to let in at this point would be Andrea and Allison, and then also our speaker, Vijay LeMay.
Okay.
So if you see any of those names, send them on.
So Ryan, I am making you the host.
Oh yeah, I guess I'll be the one doing it.
Well, no, anybody
Co-host will be able to do it too.
Yeah.
Okay.
So we can help
Where
you.
do we see the waiting room?
Yeah, and it's just under participants.
Oh, there it is. I see.
All right, so Beirut, you're here too.
Yeah. Hello, everyone. Hi, Mark. Hi, Ron.
Hi.
How are you?
Great.
Nice to see you again.
All right. Okay, so if you guys don't need anything, I am gonna hop off, but I'm also happy to stick around for a couple more minutes.
No, I think we should be good.
Yeah, it
Okay,
sounds like
so-
we don't have that annoying little bing when somebody joins, because I think we want to make sure that's off.
Yeah. Also, actually, I do want to point out one thing. We have a license for GoToWebinar. Obviously, we don't want to switch it for today, but that is an option for subsequent meetings if you guys are interested in. But if we're still kind of doing like the breakout room model, I think Zoom is probably better.
Yeah, I think in terms of these webinars, we're not really doing breakout rooms kind of as they're currently designed. We might do some other types of events that would utilize that more, but
yeah.
So GoToWebinar might be an option.
Okay, well, I'll look into it a little more and just like see if it actually offers any better, like if it's offering anything that Zoom is failing to meet your needs in, but as it stands, I think Zoom is probably doing okay.
Yeah, Zoom's working great so far.
Awesome.
The benefit with Zoom is you could see people's faces if you wanted to, or have folks go on camera to ask a question. But other than that, it's mostly about.
All right. Okay, so I'm gonna hop off. I'll just try and get you guys a recording of this on Tuesday or Wednesday, and we'll see.
Okay.
And also, just when people actually start coming in, I know that we talked about like in the RSVP tool, you let them know that it's going to be recorded, but just mention that when the meeting starts.
Yeah, I'll add that to the announcement slides.
Yeah. And by remaining on the call, you are consented to be recorded, blah, blah, blah.
Okay.
All right. Bye, everybody.
Enjoy Portland.
Oh, I will.
New niece, nephew?
She's not that new, but she's still pretty great.
Okay.
Yeah, FC here. I will invade. Yeah. So we have the dog. And then Denise.
Oh,
Ellie.
Hi.
Scientists are looking at you, Ellie. You're cute. All right. Bye, everybody.
Bye,
Bye.
Rob. Thank
Thanks
you.
so much. The Geohealth Early Career Webinar. My name is Ryan Harp, and I'm pleased today to be joined by Dr. Vijay Lamay, who is a climate and health scientist with the National Resources Defense Council. Just some quick announcements. So again, thank you for joining us. We're going to start with a presentation by Dr. Lamay and then move on to a moderated question and answer. If you have your audio and video on, if you could please turn them off just to allow for everyone to stream most effectively. And also note that this session will be recorded. So by attending, you are given permission to appear in any fashion that you do today. If you have any questions that come up during the talk, please pass them along to the Zoom participant labeled Ask Questions Here, and then we'll work behind the scenes to try and get those organized and ask those at the end to Dr. Lamay. Also, just a reminder that this is a monthly recurring webinar. So again, the Geohealth Early Career Webinar, the goal here is to feature research talks by early career scientists, as well as provide some supplemental professional development topics. The goal is to have this every month on the second Friday of every month at 2 p.m. Eastern, 11 a.m. Pacific, or in this very time slot. We are still working on securing our speaker for March, so stay tuned for updates. We'll also be hosting a second session on how to convene and host a session at the AGU fall meeting. And so yeah, both of those, keep an eye out. Also, if you are not currently receiving emails from us through our email list, please sign up at that link below, and we'll have somebody paste that into the chat just to allow you to access that more easily. But with that, I'll go ahead and kick things off here. So Dr. Vijay Lamay is our speaker today. He's a climate and health scientist with the National Resources Defense Council, or the NRDC. Dr. Lamay is an epidemiologist who is broadly interested in addressing the public health burdens of air pollution and extreme heat by quantifying, communicating, and reducing the risks associated with climate change. Dr. Lamay earned his PhD in environmental epidemiology from the University of Wisconsin-Madison, where he was co-advised by our speaker back in November, Dr. Tracy Holloway, as well as Dr. Jonathan Patz. So we're inadvertently keeping things within the family for the time being. In his current position with the NRDC, Dr. Lamay leads economic valuation work to describe the health costs of climate change, which is of course the focus of today's talk, and also to help defend the science underlying the Clean Air Act. Before working with the NRDC, Dr. Lamay worked as a scientist within the Environmental Protection Agency, and has also earned several awards and fellowships for his work, including a Global Air Quality Fellowship through the U.S. State Department, the Presidential Management Fellowship through the U.S. Office of Personnel Management, and an Epidemiologic Investigation Fellowship with the California Department of Health, as well as several others. Perhaps most impressive, Dr. Lamay can speak 3 languages and is familiar with 2 more, and that's not even including any programming languages that he might use. So with that, we're really excited and fortunate to have Dr. Lamay with us today, and I will hand this right over. So if you could go ahead and share your screen, Dr. Lamay, we will kick things off.
Great. Thank you, Ryan, and thank you to the Geohealth section. And thanks to all of you for making some time today to join us. I'll just start the talk by saying that I've got a lot of respect for AGU. I've been involved in one way or another for quite a while, attending meetings. My dad's a planetary scientist and my twin brother is a geologist. So we've got a lot of AGU love in our family, and I'm really excited to join you all today and talk a little bit about our work on climate change and health from an economic perspective. So I'm gonna go ahead and get this going here. Okay, hopefully you can see my slideshow. That look okay?
Yeah, it looks great.
Great. Thanks, Ryan. So as Ryan mentioned, I'm a climate and health scientist with the Natural Resources Defense Council, NRDC. So I'm just going to start the talk by giving you a brief overview of who we are for those of you who haven't heard of us. NRDC is an international environmental advocacy group. We were established in 1970, so just turned 50 years old last year. And we work around the world using science the law and policy advocacy to advance human health and environmental protections to help sustain life and the natural systems on which all of life depends. So this slide just depicts me and my colleague, senior scientist Kim Knowlton, who's been working on climate change and health at NRDC for more than a decade. We are really strengthened by our huge membership and activist base. More than 3 million Americans partake in online and in-person activism when that's safe. And we right now have about 700 folks on staff. That's everybody, including scientists like myself, but also a whole bunch of lawyers. You may know us from our hundreds of lawsuits during the Trump administration, and then a lot of policy advocates and really a whole crew of us working in various areas to advance climate and clean energy solutions, healthy communities efforts to clean up pollution and reduce environmental inequities, and also a nature program that works to advance species protections and works quite a bit in the international setting as well. So this map just depicts our US offices. We have a bunch of them. If anybody's interested in internships and other opportunities to kind of connect with our work, I'm happy to connect with you either during Q&A or after the talk. I'll just mention that we do work both in the US and internationally. My talk today is focused quite a bit on the US work, but I also am engaged quite a bit with our India team on air pollution and extreme heat resilience. Okay, just in terms of kind of the big broad areas of our work in climate and health at NRDC, it kind of falls into these 4 bins. The first is just communication on the links between climate change and health. All of you are joining this webinar today, so I'm guessing that a lot of you are familiar with the health consequences of the climate crisis. But if you look at the American public at large, we still have a long way to go in terms of making it apparent that the climate crisis is not just about the ice caps or polar bears, but it's really about human well-being. The societies that we have built around a stable climate are all in peril. And so certainly that has risks when it comes to human health. Unfortunately, in surveys over the last 5 or 10 years, most Americans are not able to identify even a handful of health consequences of the climate crisis. So we do quite a bit of work on communication and research and analysis, which I'll describe today, trying to make the climate problem more tangible and more local for people in order to help to motivate action at multiple levels, including civil society, engage citizens in policy change, as well as informing decision makers about what we think should happen. We're also engaged quite a bit at the US level in trying to advance climate change adaptation planning. I think in the past, there's been this sort of false dichotomy between slowing climate change through carbon pollution mitigation and helping prepare communities for the climate-related harms that we know are on the way. And I think more and more we're seeing that both of these things, climate change mitigation, and adaptation need to happen, but that we've really neglected to invest in climate change adaptation and preparedness. So fewer than half of US states right now really have health-centered plans for climate adaptation, and we're working to help to address that issue at the state and local level in the US. And then we're also engaged in quite a bit of advocacy. Of course, the last 4 years have been an exceptional struggle in terms of trying to get the federal government on board with addressing this brewing crisis. But I think we've really turned a page in the last few weeks, even in terms of how we respond. So today's talk is really focused on the economic dimensions of climate change impacts on human health. And I do want to recognize that this sort of framing of the problem has been receiving increasing attention, thankfully, over recent years. This is a quote from the 4th National Climate Assessment, a landmark report published in November 2018, which is part of really an ongoing effort to synthesize and summarize the main climate science that probably many of you are involved in producing, and allow policymakers to understand the consequences of climate change in this country. So this is a publication that the US Global Change Research Program engages in on a sort of cyclical basis. So the 5th National Climate Assessment is kind of just getting going right now. But this report in November 2018 really made headlines because it drew attention to the fact that, like I said, climate change is not some distant problem, but one that is here and now and already inflicting huge costs, both in terms of human health as well as healthcare costs, as well as damage to property, crops, and infrastructure across the country. So I think this was sort of a wake-up call for many people in terms of understanding that there are real economic risks associated with the climate crisis, and really there's a need to better articulate those risks when it comes to human health. I'm just going to play this brief clip from Special Envoy Kerry, because I think it really draws attention to the fact that we have seen in the last month or so, I guess a little less than a month, sea change when it comes to the federal government's response to this crisis. Oftentimes people ask whether the cost of responding to climate change are too high. And I think Secretary Kerry, sorry, Special Envoy Kerry, former Secretary Kerry, had a good response to that question.
It costs a lot more. There are countless economic analyses now that show that it is now cheaper to deal with the crisis of climate than it is to ignore it. We spent $265 billion 2 years ago on three storms, Irma, Harvey, and Maria. Maria destroyed Puerto Rico. Harvey dropped more water on Houston in 5 days than goes over Niagara Falls in a year. And Irma had the first recorded winds at 185 miles an hour for 24 sustained hours. That last year, with one storm, $55 billion. So we're spending the money, folks. We're just not doing it smart. We're not doing it in the way that would actually sustain us for the long term.
Okay, hopefully that I did Zoom right and that audio came through. Let me know if not. So, their Special Envoy Kerry really sort of threw out a bunch of dollar figures, right, in terms of the billions of dollars that the federal government is already paying to deal with these climate-sensitive harms in terms of extreme storms and hurricanes, for example. But it's worth asking sort of what's included in that math. I think the case has already been made that climate change is cost beneficial, but in terms of including public health in those costs of continuing delay and inaction, we really have a long way to go to catch up. I'll just point out that the trend lines here, and this won't probably surprise any of you, are really, really worrying. This is a map of the climate and weather disasters that hit the US last year. It's a map that's regularly published by the National Oceanic and Atmospheric Administration, NOAA, part of the federal government. NOAA has been working for the past 4 decades really to track the most expensive climate and weather disasters across the country. It's done phenomenal work in trying to understand how climate and weather disasters are inflicting tangible damage to states across this country. Last year, unfortunately, really shattered the records in terms of NOAA's data on this problem. Last year, there were $22 billion disaster events across the country, and the agency estimates that those events cost about $95 billion in economic damage, and that's to property, crops, and infrastructure. So, certainly any of you on the West Coast lived through a historic wildfire season. Some of you might have seen your Instagram feeds light up with orange skies in the Bay Area. I think it's important that we remember that these climate harms are occurring year after year. They're getting worse, even though our media attention may shift from one to the next or completely away from these issues. This is an ongoing burden to this country. And you can think of climate change as sort of a tax right now. Our tax in terms of delay and inaction, it's a tax that's random. We don't know where each of these events is going to hit from year to year, but we know what the general trend is going to be. It's progressive in terms of inflicting damage on the most vulnerable amongst us, people who are economically marginalized, communities of color. And it's a rising tax. We know that the trends are pointing in one direction. If you look at sort of the long-term trends from NOAA's data, you can see, if you look just sort of graphically, the top half of this slide, the red line represents the kind of march of billion-dollar disasters through the year, ending at that 22 on the right-hand side. Every other line on that chart is another year, most of them in the last 5 or 10 years. So you can see that overall, we are heading in the wrong direction. If you look back in time, in terms of the average annual cost of these really expensive events or the number of events, all of the trends are pointing to, really a flashing red emergency light when it comes to really, really worrying picture when it comes to where we might be headed in the future if we fail to kind of step up to the plate here. I want to point to a figure published 20 years before that fourth National Climate Assessment. This is from my PhD mentor, Jonathan Patz at UW-Madison, who really has been a pioneer in the field of climate change and health and was one of the first researchers to really draw attention to the monumental risks that climate change poses for human health. So when we talk about climate change and health, we're really talking about fundamental changes in the functioning of our system. Of course, temperature rise comes to mind, but also sea level rise and changes in the hydrologic cycle. Apologies, many of you probably are familiar with this science, but we're expecting both extremes of the water cycle, extreme drought, as well as stronger precipitation events that drop huge amounts of precipitation in extreme storms. So through a lot of research over the last decades, we understand that climate change is related to a whole host of health relevant exposures. Those are depicted in the middle of this chart. So we're talking about everything from the urban heat island, in which paved urban areas experience really high temperatures relative to their suburban surroundings, which of course pose risks for heat exhaustion, heat stress, and other heat-related health outcomes. But also an air pollution problem. We know that the same fuel sources that drive the climate problem, fossil fuels, also contribute to huge air pollution problems in this country. More than 130 million people living in areas that exceed the national EPA standards for ozone, smog, air pollution, for example. And that's associated with all sorts of heart, respiratory, health problems. Really, nearly every organ system in the body is damaged by air pollution. We're understanding more and more about those links every day. Not to zoom by the rest of the slide too quickly, but I just do want to mention that the climate crisis is implicated in a whole host of health problems. We're talking about everything from certain types of infectious disease outbreaks to changes in the supply and quality of water, as well as environmental displacement. And so when you think about the whole kind of breadth of climate research, it's really striking that a really tiny fraction of it is actually focused on human health. The Lancet Countdown on Climate Change and Health, a couple of years identified about 1% of climate research is actually focused on human health outcomes. And so, as you can tell, we really have a long way to go in understanding the problem and advancing health protective policies that can help to mitigate the damage in this country and around the world. So this all brings us back to that kind of main question of this talk, which is trying to understand how much damage climate change is doing to our health in economic terms. And that was really kind of the motivation for a lot of the work that I'm going to describe for the rest of this talk. We think at NRDC, this is an important question to answer, right? Because right now we have basically left health on the sidelines of our cost-benefit analyses for climate change. When we think about those billion-dollar disasters that NOAA is tracking from year to year, the agency does some accounting of like the number of people who died in the California wildfires last fall, for example. But it does not track all deaths, illness, and injury associated with climate-sensitive events. In fact, no one is comprehensively tracking at sort of a government level the health effects of climate change. And so when it comes to understanding the financial toll of this problem on Americans and their families and their communities, we really have very limited insight into that problem. But it's an important question to answer for a number of reasons that I'll describe today. Of course, in this country, we have a fairly dysfunctional healthcare system, one that is bankrupting, tons of people, one that, we have more than half of American adults right now reporting medical financial hardship, which means that they are either delaying or completely foregoing needed medical care because they just can't afford it. And so if we put sort of that math alongside the climate projections, we're facing, huge problems when it comes to responding to this crisis and ensuring that we don't further deepen economic disparity in this country. And so that's sort of what motivated this study. I mentioned sort of the main info on this slide in terms of our cost estimates really being confined to things that are insured or repaired, things that already have dollar figures pretty readily attached to them. Property damage, crop failure, infrastructure damage, all of those things are relatively easier to count because there's already been some sort of economic assessment attached to them. For human health, there's been much less of a project to comprehensively link health effects and economic costing. So at NRDC, we've been trying in our small way to start to fill the huge, huge gap here when it comes to our understanding. Our approach has been to apply a case study method to try to use recent climate-sensitive events, connect those events to health outcomes using publicly available data, and then connect that health outcome information into economic costs using statistics and data collected by the federal government, especially at the Agency for Healthcare Research and Quality, AHRQ. So we've been trying to basically connect the dots here, integrate data sources. This isn't rocket science. It's just about spending the time to collect the data and connect it, integrate it in a way that really we think the federal government ought to be doing. So along those lines, we published a kind of first of its kind study, Kim Knowlton and colleagues, about a decade ago, looking at climate sensitive events. And then I came on board at NRDC about 3 years ago and began on the project to kind of expand and update that analysis. So this is that first study published in 2011 in the journal Health Affairs. And it really kind of made a splash in terms of trying to synthesize the available information on climate-related health outcomes and their costs. The study looked at 6 case study events spanning between 2000 and 2009, I believe, to basically connect the dots and understand, in each of these case study events, a heat wave, wildfire event, flooding in North Dakota, an outbreak of West Nile virus in Louisiana, as well as hurricane impacts in Florida and national ozone air pollution exposures. If you add up all of the illnesses and deaths associated with those events, you end up with about a $14 billion price tag. And that's using, again, economic valuation methods already deployed by federal scientists like at the Environmental Protection Agency in their regulatory impact analyses. And so that was kind of a first analysis about a decade ago that was published. And we followed up that study with one of our own in the AGU journal Geohealth that was published in fall 2019. And we basically expanded on that case study approach, but we changed the methods a little bit. First, instead of looking at a number of years, we confined our analysis to a single year. And we focused on the year 2012. Again, we were kind of restricted to publicly available data sources. We wanted to demonstrate what could be done using the existing, evidence base that's public, but also shed some light on what other harms we might be able to illuminate if we had a more integrated, transparent data sharing system. And so here we deployed a similar cost valuation method, looking at both the burden of illnesses, morbidity, as well as early deaths or mortality. And that's important because morbidity has been largely ignored. The whole topic has been really sidelined, but understanding illnesses and injuries and those costs has been really kind of left behind. And so we wanted to focus on both sides of the health impacts here, both early deaths and morbidity. So this is an animation sort of depicting the overall scope of our case study analysis. So each of these case study events was what was ultimately included in the paper's analysis. And so in sort of trying to select events, we focused on those that are, of course, climate sensitive. So we relied on the National Climate Assessment, the 2016 Climate and Health Assessment, to basically, isolate our work to climate sensitive exposure events. We wanted to represent a diverse geography, and I think we were, somewhat successful in doing that, and also highlight some new states. So of course, California has done a great job in collecting health data and is one of the leaders nationally in sort of health surveillance when it comes to climate sensitive risks. But we wanted to also highlight a number of other states that weren't featured in the first study, drawing on the available information. So each of the case study events here is, linked to climate sensitivity. It is expected to worsen in one way or another in frequency or intensity or duration or geographic scope into the future with unchecked climate change. And so we wanted to represent the sort of breadth of climate sensitive health outcomes. I want to note here that this was by no means a climate change attribution study. I am not a climate attribution scientist. I'm an epidemiologist. Certainly, there has been great work and increasing work over recent years to attribute specific exposures to climate change or attribute the likelihood of those exposures to climate forcing. That wasn't the project here. Really, this was a baseline analysis to give us an understanding at the state level what's happening out there so that in the future, if future studies are conducted, we can look back and try to understand where the trends are headed. The other sort of reason for the state approach here was to shed some light on the fact that climate change is really a local problem when it comes down to it. It's something that we hear on the news. We hear about the IPCC gatherings. We hear about national, climate envoys doing the work. But really, when it comes to climate impacts, it's everywhere, right? And so we wanted to make sure that we were highlighting local stories and local exposures when it came to doing this research. So I mentioned our methods for estimating health costs. We really tried to think comprehensively about the story of health when it comes to paying for it. So we wanted to calculate the costs of premature mortality using that value of assisted life metric employed by the federal government. And we also, of course, wanted to account for the direct costs of medical care, which in this country are extraordinarily high. But we also wanted to think about the other costs associated with going to an emergency room, for example. If you're in the hospital for a number of days, you may have to forego wages from your job. So we wanted to incorporate that. We also wanted to think about the costs that people and families incur after you leave the hospital. You may have the need for ongoing outpatient care or home health care visits from a physical therapist, for example. And oftentimes you may be prescribed certain medications, right? So we took advantage of the medical expenditure panel survey, as well as the healthcare cost and utilization project. Those are two federal databases that are totally publicly available that connect disease codes, international classification of disease codes, to healthcare costs. And so we basically tried to, stitch together each of these estimates to better understand the whole scope of charges involved. I mentioned that this isn't rocket science. It's not. It's really about taking the time to gather the evidence, right? So I spent the better part of a year and a half stitching together data sources from public sources across the peer-reviewed literature, as well as data collected at the state and local level when it comes to health departments, as well as the federal government across a number of agencies. So this table here just sort of depicts the scope of the sort of data project here. We ended up relying on about 36 data sources. We know that we sort of barely scratched the surface when it came to some of these case study events, but it was what we had to rely on. And I'll just step back for a second and say that, this is pretty unacceptable, right? That if we have to look back, 8-9 years in time, we were looking at the year 2012 and gather the data in order to understand just the basics of what's happening in terms of climate sensitive exposures. This is a project that really shouldn't rely on the research community to address primarily. This should be something that researchers are working inside our government to address as well. And so hopefully in this new era of climate action, we'll see increased appetite from folks at CDC, EPA, NOAA, and elsewhere to start doing some of this work because we really do not have the time to spend another, several years just gathering our ducks in a row to understand what's been happening. We really need to be more forward-looking in our analyses. But that said, here's what we ended up with in terms of our methods. This slides are sort of busy, sorry. So I just want to mention that we did some amount of data imputation. So for example, trying to estimate the number of hospitalizations that resulted from people who visited the emergency room, for example. We collected data across a number of data sources, everything from EPA estimates for the value of a statistical life to those HCUP and MEPS health cost information collected by AHRQ, that Healthcare Research Quality Group. And so it's basically trying to connect all the dots here that gave us our ultimate total health related costs at the bottom of the slide. And I'm happy to talk more about the methods in Q&A or afterwards. In terms of just sort of making these health risks more specific, I wanted to point to this table in the paper, which really is kind of a grim compilation of the climate sensitive health harms that we identified across this case study set. I don't think it's lost on anybody that, you know, serious events like Hurricane Sandy that we looked at out east, or, you know, extreme heat in my home state of Wisconsin, those are life or death situations, right? And people died in those events. But it might be much less apparent, it certainly was to me, that each of these events is also associated with really kind of scary outcomes when it comes to illness, right? So there were pregnancy complications that were reported in Hurricane Sandy, as well as disrupted dialysis care at hospitals that weren't able to keep the lights on during that event. It's also important to consider what's not on here, right? We looked into mental health outcomes from Hurricane Sandy, for example, but we know that a number of events, including wildfires out west, have extreme mental health consequences, but we really lack the data to shed adequate light on that burden. But nevertheless, this is the sort of categorization of each of the disease codes that ended up being included in our analysis. So we relied on the health studies, epidemiologists and others, doing the work to report using consistent methods like that international classification of disease system, the burden of each of these events. And we did our best to sort of catalog the health outcomes here, just so you could see them all in one place. And even though, you know, we're acknowledging that this still represents a partial kind of accounting of everything that happened across the country in 2012. So I mentioned we were, you know, attempting to shed some new light beyond that first study on health harms. And I mentioned a lot of them associated with Hurricane Sandy. I'll note homelessness, anxiety and depression, substance abuse, all those analyses were included in this work. I also want to give a shout out to my former colleagues at US EPA who helped to advance really great modeling work on wildfire smoke, especially fine particulate matter, PM2.5. Those are the really tiny microscopic particles invisible to the human eye, but really harmful to human health because they can bypass our body's natural defense systems of, you know, coughing or sneezing or swallowing. They actually enter deep into our lungs, enter the bloodstream, and can inflict terrible damage on nearly every organ system in the body. So Neil Fan and others at EPA have been working to advance the project of modeling wildfire smoke impacts and sort of isolating the amount of air pollution in American cities and rural areas that's coming from the wildfires themselves. So there's a lot of work to do in the wildfire smoke science area, but we try to at least report some of the findings that were included in that EPA study. Wildfire smoke, I'll just mention, is a widespread and growing problem, of course. We at NRDC have done prior work demonstrating that the area affected by wildfire smoke can be as large as 50 times the area actually burned directly by the flames. And so, you know, certainly while, you know, I'm watching the news about what's happening in California, it's important to recognize that millions of people are exposed to wildfire smoke at this point every year. And they historically have been treated by EPA as exceptional events that are kind of excluded from the math when it comes to Clean Air Act attainment or non-attainment. But more and more, these are less exceptional, right? We are seeing chronically high wildfire smoke exposures across huge swaths of the country year after year. And so maybe it's time that we rethink how we capture those exposures in our legal designations of what's actually meeting air quality limits or not. So without further ado, I'll just point to some of the key results from our study. This is the health impact slide. So we basically tried to add up the number of deaths, hospitalizations, and ER visits across each of the case study sets here. We ended up with some pretty stark numbers, you know, more than 900 deaths, more than 20,000 hospitalizations, and nearly 18,000 ER visits. And so, you know, this is basically our attempt to use a consistent method to count and not double count what was happening across the country in this one year, and to try to estimate especially the morbidity burden. I think it's lost on folks in the health policy context that, we're talking about tens of thousands of encounters with the healthcare system every year related to climate sensitive events. Each of those has a real cost in terms of, a price tag, but also time. And that, sort of accounting has really not been included in our understanding of the burden that this problem is facing, is, putting on our healthcare systems as well, and just trying to sort of manage the influx of patients that are dealing with these really scary problems. When you attach those health figures to the economic costing available from the federal government, we end up with some pretty big price tags here. So overall, we're talking about an overall price tag of about $10 billion. That is largely attributable to the mortality burden of $8.4 billion, but another, $1.6 billion associated with those tens of thousands of ER visits and hospitalizations. That aligns with other studies in terms of the mortality burden really swamping the overall economic assessment. More than 90% of the damages typically are attributed to the effects of premature mortality, and certainly there's been increasing discussion about how to think about the value of a statistical life. But we are using, basically the same metric that EPA has been using lately. So this was our attempt to kind of align our methods with what's been out there in the regulatory world as well. So a $10 billion estimate, just to give you some context, the NOAA folks estimated that the 2012 burden of climate and weather disasters was about $39 billion. So this just gives you some sense that if we're talking about a sample of human health case studies, we're still just talking about, a 25% extra price tag that we're adding to the national burden for just 1 year. But in thinking about that as $10 billion, it's important to give, and the 1.6 attributable to illness specifically, it's important to think about who's paying, right? Those costs are not borne equally by each person in this country. Unfortunately, doing work to identify the expected payers, we found that a disproportionate share, more, approaching 2/3 of that $1.6 billion price tag for illness were paid by Medicare and Medicaid patients. Again, that finding aligns with our scientific understanding about who's actually facing the worst burden from climate-related health risks. It's older folks, it's the economically disadvantaged, it's those, basically least able to cope with the financial burden of this problem. And so this is an important, equity concern that's really, I think, illuminated by some of these numbers, but even though it's consistent with sort of what we expected to see. So of course, the challenge here is getting beyond these case study types of analyses that really only can pick apart part of what's happening in the country during a sort of snapshot in time to extrapolate. So we're, again, not talking at this point about attributing specific health harms to climate change just because we don't yet have the tools to do that on a national scale with all of the different exposures and complexity involved. But nevertheless, it is sort of time, to think about the big picture, think about what this country and our world faces if we continue down this path of basically inaction and delay that doesn't meet, what science tells us we need to do in terms of cutting emissions specifically. We tried to draw some attention to sort of the broader fabric here. This is the last figure in the paper, which is an attempt to try to extrapolate a little bit. We basically looked at the available national information on each of these case study exposure events. So for example, the number of Lyme disease cases in the country in 2012, not just in Michigan, but across the country. And we tried to relate those to what was actually included in our study. So here on each of these bars, the blue portion represents the health burden represented in our analysis. And the yellow segment, percentage-wise, represents everything else that was out there nationally based on the available data. And so you can see here that depending on the case study, we captured either anywhere from very tiny amount of the national burden when it comes to things like Lyme disease or allergenic pollen, to probably most of the national burden when it comes to deaths and hurricanes, for example. And so if you kind of just extrapolate from the information in this chart as well as the information in the National Climate Assessment, we are talking about hundreds of billions of dollars of healthcare related costs linked to climate sensitive events year after year. but certainly we need to do a lot more to put a finer point on that number and constrain it in a more kind of rigorous way. I mentioned that part of the sort of side aim of this study was to draw attention to the local effects of climate change. We were heartened to receive a fair amount of local coverage of the Geohealth study, local outlets that reported the climate harms in a new way, drawing attention to the economic costs of continuing inaction on the crisis. We also did some subsequent analyses, like in the lower right, the governor's office in Oregon reached out after the study was published to ask us for estimates of the health costs related to smoke exposures in that state, because we only looked at Colorado and Washington's 2012 burden. So I think we are seeing increasing interest from policymakers. The Wisconsin governor's task force on climate change looked at our report and cited it in kind of trying to make the case for more ambitious, aggressive action in the near term to avoid expensive suffering in that state. We're doing quite a bit of communication, of course, around this, trying to connect this study to what's happening in the news. And since this is a early career setting, and I hope we have a lot of time for Q&A, I'd love to talk about how to sort of frame this problem and make it more relevant, especially to younger folks who we've seen are really interested in the problem, but trying to understand what it means for them and their future. I mentioned the Wisconsin governor's report. It was heartening to see that this sort of framing that climate change is here, it's now, it's costly, is making it more and more into the narrative. I do want to mention that 2 months ago, I led a new analysis, more of a commentary in the journal Health Affairs again, really trying to draw attention to the bigger policy questions here. Health Affairs is a big health policy journal. This is an open access paper. They made, thankfully, the whole special issue that covers climate and health open access. I really encourage any of you who are interested in sort of the connections between your Geohealth work and health policy to check out that special issue. There's so much cool work in there, and we were grateful to be a part of it. So this piece in Health Affairs that just ran really is an effort to try to bring the healthcare professionals into this discussion about economic valuation and to try to kickstart more action to try to expand the deployment of this type of method elsewhere. So along those lines, I think the policy recommendations here won't shock any of you. We, of course, are making the case that climate change inaction is costly, too costly, and too damaging to our health. So we need to redouble efforts on mitigation and adaptation and increase investments so that they're commensurate with the need. We also need to improve surveillance and tracking, which I will harp on the next slide, and really deploy better cost estimates that are more comprehensive rather than just sort of isolating ourselves to this case study approach. I'll just get on my soapbox for a second when it comes to health data and sharing. I think this is likely a problem that many of you may face in your research, in your careers. It's certainly one that I encounter. And maybe if I was a better programmer, I'd be better equipped to deal with some of these issues, but some of them are chronic and kind of immune to programming expertise. I think we believe that expanding sort of the valuation method can further demonstrate the benefits of climate action, sort of flip this on its head, flip the script and talk about not just the cost of doing nothing, but the cost savings of acting aggressively. What can we do to avoid suffering and the expense to people from what sort of the path we're on right now? We also need to, of course, expand our investments in staff and expertise at the local level in order to help public health agencies better sort of frame what they're up to in terms of economic cost and benefits. But we also really do need to invest in public health data surveillance systems that are 21st century tools, right? The right side of this picture shows a staffer at CDC about a year ago, right, working on COVID. And I am dismayed to see that CDC has been relying on really antiquated tools for data sharing, fax machine printouts, recordable DVDs, emailed spreadsheets of airline passengers. I mean, this is no way to run a 21st century health surveillance data system. It's really a national embarrassment that we find ourselves in this place. decades of underinvestment in public health at the federal, state, and local level have brought us here to a point where life and death decisions are being made and they're transmitted from state to state on a fax machine, some technology that many of you have probably never even seen in your lifetime. So I'll just get off my soapbox, but mention that, it's really time that we modernize what we're up to in terms of health surveillance and make data sharing more of a priority and rapid sort of data sharing more possible for all of us, including the research community. End rant there, hopefully. I'll just mention that, I talked a little bit about sort of the co-benefits framing here tangentially. A lot of you are probably familiar with this way of trying to make the case for climate action. I think, and I'm interested to hear your thoughts on this, we need some sort of balance of trying to be sober and real about the risks that this country faces, but also represent and demonstrate a positive vision for the future, that there are all these positive side effects of cutting climate pollution and increasing adaptation ambition. And I think, there's ways to make these co-benefits, probably by using a different term, more sort of accessible and helpful to people, making it apparent that climate action is really about human health, well-being, prosperity, and a livable future for all of us. So on that note, I just do, it can be kind of doom and gloom world working on climate change and health. So I do want to kind of end on hopefully a higher note. This is a picture of New York City, back in 1966, before the Clean Air Act was passed. Thankfully, it's probably unrecognizable to most of you. Through the achievements of that landmark law, we have seen more than $2 trillion in health benefits. When you stack those up against the cost of about $65 billion in compliance costs, we end up with cost-benefit ratio of basically 30-to-1 benefits to costs here. So huge health savings from our efforts to clean up our air. And I think that sort of bodes well for where we can head in the future, right? Action on this crisis, as we have shown a little bit through some of this work, can save lives and billions of dollars, not just in 1 year, but for years and years to come. So I'm hopeful that we can sort of use the lessons of the past to try to shape a smarter future and a healthier one for all of us. The last sort of point I'll make is another study that I led in that Health Affairs Journal back in December. This one's really focused on climate change and health education. Any of you who are engaged in teaching on climate change and health, I'd love to talk to you about this work. Maybe later on, just check it out. It's in that special issue. Basically, we tried to come up with a way to make the climate change and health sort of topic more readily teachable by breaking it down into component parts, trying to make it clear that the climate problem is not just some engineering challenge, but it's really one that involves human health very centrally. And so happy to talk more about that work. It's another open access one available through Health Affairs. So with that, I'll just leave my contact info up on this slide, and looks like we've got 10 minutes or so for Q&A. Thanks, everybody.
Well, thanks for that. Great talk, Dr. Louie. I know there's, at least for me, there's a lot to think about coming away from that, and a lot of certainly eye-popping statistics that you shared with all of us. And yeah, in terms of the Q&A, we have a bunch of questions that have come in and that we have gathered from the registration process as well. So I'll kick off with one, actually, that you had mentioned a couple times in your talk as you were going along there, which is how to frame these costs in a way that gets out into the public and raises awareness. And I don't know if you want to take the opportunity to expand on that, if you have any suggestions for what those of us who are researchers, which I think is most of the audience here, do you have any suggestions for us to be able to do that?
Yeah, I think it's a symptom of our media environment, unfortunately, that, in one of the only climate questions that came up during last fall's pretty much unwatchable presidential debates, the way the question is framed right now is, isn't the Green New Deal too expensive for this country to deal with? And, the other side of that question is, look at the huge, costly suffering happening in every corner of this country that is in part linked to doing nothing. Right? Doing nothing has a cost. And I think more and more, we all need to remember that and point that out when we hear about people, on the news threatening to, saying that they're threatening to take away our hamburgers or whatever, right? There is real cost and suffering and death and illness and all sorts of ugly stuff happening that's linked to climate change. It's all going to get worse if we fail to step up. So I think for me, it's an important reminder that, doing nothing comes with a cost, and we really need to make that argument. Gina McCarthy, the former NRDC president, who now is part back in the Biden administration, made that point before Congress in a select committee, climate crisis select committee hearing about a year ago. So I increasingly think we all need to be sort of vigilant on that front.
Yeah, I think that's a great point. I mean, the cost of inaction get overlooked all the time.
Right.
It gets washed away. So yeah, certainly framing things around that is helpful. Moving on to another question. So you talked a few different times there about data availability and things of that nature. So I know you talked a fair amount about trying to modernize the system. I'm curious if you have any thoughts on there, but we also have a question that is more framed from those of us coming from the climate or earth science side of things, which is, to further analyze these links, what type of information is most needed from the climate science community? And are there any gaps that we might be able to fill in regards to particular parameters that we are sharing with the community, model resolution, uncertainty, things like that? So I guess I'll kind of open this up as a overall data question.
Yeah. Those are great questions. The one that comes to mind is, in terms, I'll just start with the health data, and then I'll circle back to the geoscience exposure data, especially. On the health side, we saw last year, basically news organizations, the New York Times had to sue the Trump administration in order to understand the racial disparities of COVID-19 on people across this country. We certainly need public health agencies, those with the health data, to prioritize sharing of that granular information when it comes to each of these disparities, when it comes to age, when it comes to sex, when it comes to race, because that can help us to design and monitor interventions and understand if they're having the desired effects of reducing these really stubborn, long-standing disparities. When it comes to the environmental modelers and folks doing work to kind of better understand what's happening out there in the world, I think it is important to remember that we're trying to kind of strike the balance between precision and I'll say like sort of policy applicability. One of the reasons I love working at NRDC is that we don't sort of wait for the science to be completely settled, because oftentimes that can take far too long while real kind of harm is being inflicted and shouldered by huge swaths of the population out there. So I think it's important to think about framing your work. Think about a policy brief that accompanies your paper, or a blog, or a talking point that really speaks to policy issues, connects your work to decisions that are being made at any level of government. I wish I had taken advantage of more of that sort of tool while I was in graduate school. And I think it's a great way to make your work more tangible to all sorts of audiences. And I think, don't be afraid to promote new advances, new understanding, a question that you've sort of tried to help answer through your work. And, do your best to stay away from the jargon that is so prevalent, especially in the modeling spaces that we all work. If I'm talking about 2-meter air temperature, that means very little to people out there, right? So just talk about the sweltering, searing heat that people are experiencing on a chronic basis, day after day. So those are some tips that come to mind.
Yeah, those are some great suggestions, and I'll also give a shout out to the AGU Sharing Science community.
Totally.
Which, I'm sure you're familiar, but for those of you who aren't, they do an excellent job of sharing all sorts of different science communication tips, including how to, put forward policy relevant documents and frame things in that manner. So I would definitely give a shout out to the Sharing Science team. One question that came in on a slightly different note, which I know is one that was, those of us who are organizing this, we're talking about, how do you get involved with the NRDC? So I think that could be not just the NRDC, but other similar advocacy type organizations, both from probably a volunteer perspective, but then also as a potential career option like you are currently enjoying.
Yeah, totally. I've had, the good fortune of having kind of career experiences across academia, government, and now the nonprofit sector. So there's a whole lot of ways to get engaged with this nonprofit kind of policy advocacy space. One thing to do right off the bat that's super easy is just follow, the social media accounts, follow the Union of Concerned Scientists, follow Environmental Defense Fund, follow NRDC, see what we're up to. We don't have a TikTok yet, but we are trying to speak in human terms. We're trying to do, outreach to young folks, people across, swaths of the world to try to communicate the, importance of these problems. For me, I got familiar with NRDC actually while I was at EPA because they were the ones suing us all the time in order to advance more health protective air quality standards, for example. And I think, one way to sort of understand what we're up to specifically is to check out our website. My blog link is here, but you can see basically the expert blog of any number of our folks on staff who are trying to, advocate for specific policy solutions. That's a great way to get in touch with specific people who may share research interests with what you're up to. And then I think more and more, you can check out our career page. We offer summer internships and other ways to kind of get engaged with our work. And we also have a lot of online activism in terms of trying to pressure policymakers to make decisions that are based on science. And so there's all sorts of ways to get involved, and we really encourage that. For me, it's been a really fulfilling career path to be able to talk about my science, but then also talk about its relevance to policy and what we think should happen.
Yeah, great. That's good to know. Thanks for those suggestions. And I think kind of just adding on to that part of the conversation, I think we'll wrap up with one final question here. I know you have another engagement right after this. So what is the single most effective hazard or exposure reduction measure as it pertains to health, apart from just a blanket, we should do something about climate change? Is there anything in particular? Or maybe we can reframe it as what are your suggestions in terms of people just looking to make a difference and get involved? How do you think they could go about it? I'll let you take it in those directions.
Right. That's like the question of the hour for sure. I think for all of us, especially those in the US who've lived through the last year here, have really seen the value of science-based decision-making. It is truly life or death, right? And so we have seen the process of science, which can be confusing for people out in the public, that, we collect evidence, we interpret it, and then new evidence emerges, right? And we adjust our thinking based on the best available evidence, right? And that's how science should work, right? And this has been happening, over the last 12 months at a really unprecedented pace in so many ways. And so it's not been perfect by any means, but I do think that sticking up for science in your field specifically, but also the general enterprise of what we're up to here, right? What's a preprint, right? Like, explain that to people, right? A preprint is something not peer reviewed, but probably relevant to something that's urgent in terms of COVID, right? I think it's lost on people the extent to which the scientific enterprise has really been turbocharged in the last year in terms of COVID. So I think sticking up for evidence-based decision-making free from political interference across any sector, including public health, is kind of one of the take-home messages that I hope to leave with all of you. And I think, we've seen a really kind of harrowing year behind us, 4 years really, but I think, hopefully this sort of can guide us forward in terms of recognizing that the problems that are around us will not go away if we just ignore them or deny that they exist.
Without a doubt. Well, thank you again for joining us today. Really appreciated your time and your talk. And I know you have your contact information here for anybody else who would like to follow up with questions. And thank you to everyone who joined us today. Hopefully we'll see you in one of our future webinars. So thanks all for joining, and we'll sign off now.
Great. Bye, everybody.